everyone, and welcome to today's Fireside Chat, The Road to Patient Payment Wellness, Advancing Transparency, Choice, and Digitization in Healthcare. Thank you for taking the time to join us. We're glad you're here. We have an informative session ahead, and we'll leave time at the end for Q&A. You can submit your questions at any time using the Q&A function. I'm Melody Hendricks, Vice President of Marketing at TrustCommerce, and I'll be your moderator today. I'm pleased to introduce our expert speakers. Mohit Ballaney is Director of Healthcare and Business Development at Mastercard, where he leads strategy and business development for the commercial adoption and growth of Mastercard's healthcare solutions in the U.S. He is also responsible for Blue Sky Greenfield strategic partnership opportunities with payers, providers, and other scale players in the healthcare ecosystem. Ryne Natzke is Chief Revenue Officer at TrustCommerce, where he leads the company's growth and healthcare strategy. In this role, he fosters innovation, strategic growth, and impactful partnerships across the healthcare landscape. Thank you all for being here. We have a quick poll up now and are looking forward to hearing from you as we get underway. And with that, let's get started. We'll kick off discussing price transparency, starting with how the No Surprises Act and similar legislation has affected the ecosystem. Ryne, what have you seen in the market in response to this?
Thanks, Melody. Really appreciate the intro. Really looking forward to this conversation here with you, Mohit. And I think the No Surprises Act and the legislation around some of this stuff has been one of just a number of things that have kind of changed in the last couple of years to really impact how patients pay their bills and what information they have and how that interaction between the provider and the patient moves along. I think it's been needed, I guess, because there really hasn't been a whole lot of information to the patient. I mean, we've all been in that experience where you go to the doctor, and whether maybe it's an emergency room visit or urgent care or even just a regular visit to your clinic, and you have no idea what it's going to cost. Information you get is all really confusing. So I think it's a really good step. But I think there's also a lot of work that can be done. It's not fixed by any means yet. I guess, Mohit, what have you seen, or what do you think?
Yeah, thanks, Ryan. I tend to agree. It's definitely a step in the right direction. There's a lot of work that's been put in by providers, and that's obviously benefited the patient financial experience. But as you've acknowledged, price transparency in healthcare is not fully solved for due to poor hospital compliance, complex data that's difficult for patients to understand, and the fact that even with the data, there's other factors like insurance complexity, patient-provider relationships, which limit price shopping. In fact, many of the current rules focus on charges and list and gross charges rather than a patient's actual out-of-pocket cost. And even available tools are often not user-friendly or don't include quality metrics. And really, price transparency alone is not sufficient. Patients really need the ability to compare costs with quality metrics to make truly informed decisions.
Yeah, and I think even just setting aside stuff like, I mean, not all healthcare is planned, right? Not everybody's calling up and scheduling an appointment for healthcare. So obviously it's hard to give an estimate of something if you don't know what's happening because you're going to emergency room, it's an emergent care situation. But even on where it is kind of planned care, a lot of the legislation is just about making it available, but making something available doesn't make it useful all the time either, for all the points that you mentioned, just the method that it's in. So I think I've seen a spectrum of groups of, hey, it's available. You can go on the website, you can call in, you can get some information, you can do it. But turnaround times can be really long. Man, not everybody even knows that you can go ahead and do this. I think the groups that are, what do you think of the groups that are handling, or doing it the best? What are they doing to separate themselves from the pack, maybe going above and beyond the legislation as it's written?
Yeah, so I think in general, we're seeing efforts to make that journey as seamless and frictionless for the patient as possible. So some of the leading edge stuff that we're seeing is enabling things like Care Now, Pay Later, and card payments directly into billing portals and front desk workflows. Often this hinges on educating the patient and making them aware of the resources available to them early enough in the care journey, right at the time an appointment is being scheduled. It's making someone aware that they have HSA, FSA benefits that they could leverage, right? So really we're seeing the leading edge stuff being those innovative interest-free care now, pay later models, advanced AI underwriting, and really API-first revenue cycle management solutions for embedded finance. So that's the aspirational stuff that is really driving incremental impact within the patient experience, if you will.
Yeah, right on. No, I think we've seen a lot of this of similar stuff. What some of the things in addition to the ones that you mentioned are really proactively providing that estimate right up front, whether it's at the point of scheduling the appointment or checking in for the appointment, to really let the patient know what they're going to owe. And when you can tie that together with other pieces of data, like a real-time eligibility and benefits check, to your point, if I've hit my deductible and my out-of-pocket's wiped out for the year and it's going to be zero, great. That's really important information to take into account. That's more than just the listing of prices on a website or making something available. And I mean, I don't know if anybody really loves the idea of calling into their doctor or hospital, because things like self-scheduling and other proactive things, being able to just proactively say, hey, this is what it's going to be, versus, oh, we'll give it to you if you call in, really changes what that patient experience potentially looks like.
Yeah, no, you're spot on, right? And I can't emphasize enough how healthcare typically tends to be reactive, but we need to be doing a better job as a collective on being proactive, because patients are increasingly seeking a consumer-centric experience, right? So it's the consumerization of healthcare that we're seeing, where patients want that mobile first, text to pay, digital wallet kind of experience. In fact, 76% of patients prefer digital payment methods, and 37.6% of consumers prefer to pay healthcare bills with a credit card, followed by 32% wanting to pay with a debit card. And I know that TrustCommerce recently published a white paper in 2024. It's the Healthcare Payment Trends and Future Outlook report, which analyzed data from multiple sources, including TrustCommerce transaction data and a survey conducted by Morning Consult on behalf of Mastercard I believe it was 1,000 patients in 450 healthcare organizations. And that brought a lot of this information to light as well, illuminating how all of what we're seeing and what we're discussing today is affecting a patient's financial experience, right? And the challenges one faces within the healthcare ecosystem.
Yeah, it's one of the most unique things about healthcare. I mean, what other vertical do you have where you basically don't have an opportunity to budget for much at all? It's a huge part of what the annual spend is across for pretty much everybody in the entire country. And you often, in many cases, without some of this transparency, may not even know what you owe until well after care is given. So I think the thing too is, I mean, you can look at hospital data and it's like anywhere around a half of all patient receivables are actually collected. That's another unique thing. I mean, where else are you going to see that much of uncollectible bills and invoices being sent out? And I think that gets to another thing that I like. I don't think patients don't not pay their medical bill because they don't want to. It's just, it's confusing. It's hard. It's hard to know what you owe and why you owe it. Patients like convenience and knowing what's going on. So by tying the transparency pieces of letting somebody know what they owe and why as early as possible, and then giving them a digital way to pay that happens automatically by maybe getting that card on file and having it automatically run, or running payment plans or what have you from that, it just kind of brings all of that together to have this transparency drive good outcomes at the end.
Yeah, and candidly, you don't have to choose between what's good for the provider and what's good for the patient, right? Those interests align at the end of the day, not just from a rev cycle management standpoint, but providers can then actually focus on the heart of the issue, which is driving to better patient outcomes, because they can focus on what really matters, which is delivering care to the patient.
Yeah, I mean, I don't know, none of my colleagues and friends that have went to medical school went there because they really like billing patients and sending out confusing invoices and things like that. They want to get at caring for their patients and providing the best care that they can. One of the things that I've learned kind of earlier in my career, I used to work at Epic, and one of the things we talked about a lot of time was decision support for patients and helping them understand what the right care path is for them. You kind of touched on it earlier of more information leads to better choices, but not every care delivery mechanism is straightforward. You could have an option between surgery versus therapy, or a procedure versus rehab. And oftentimes that's viewed with the light of the clinical side of it. But I think more and more seeing the financial aspect of that being part of that conversation helps the patient and their care provider provide the right path where they're going to go.
Absolutely. And I think for providers, right, the key to success on addressing many of these systemic issues is going to be looking at things like, how do you modernize the omni-channel payment flows, partnering with ISVs, leading payment gateways such as yourselves, right? How do you embed, again, patient payment optimization into those rev cycle tools? And I'm not even talking about the leading edge stuff, which is like, if you're thinking about the art of the possible, there are things like developing a financial health index, right, for healthier consumers. But I think even just the basics, which we often struggle to get right, can really elevate the experience for patients and address many of those systemic issues that we're discussing here.
Yeah, absolutely. I don't know if anybody really loves legislation driving business decisions and where things are going. I think everybody would prefer to kind of let the market choose and go where it needs to go. And I think this legislation and some of the stuff that's going on there is just because it wasn't necessarily moving fast enough. And it was obviously a pain point for enough Americans to really drive that. I guess as you think about the coming years, let's look out 5 years from now. Where do you think the price transparency and actionability and kind of how do you think that looks to prevent the next layer of legislation that says, no, you got to go do this now?
Yeah, no, that's a great question, right? So I think we need to, as an industry, right, providers in particular, need to focus on, like I said earlier, making that patient journey experience as seamless as possible, right? Mimicking retail-like journeys, because that's the expectation of the patient, right? Healthcare cannot remain that fragmented experience, right? You can't have things like pricing that candidly erodes trust, right? Because consumers are willing, or patients are willing to switch providers just on account of a marginally better experience, right? And we don't treat patients the same clinically, right? So I think as a collective, it begs the question, why do we continue to treat patients the same from a financial engagement standpoint, right? So I think the things we need to drive towards, candidly, are that individualization, right? Highly engaged models that introduce patient financial engagement, right? It's not an afterthought at the time a procedure or service has been rendered, but it's starting at the time that someone first interfaces, right? How do what can someone afford, right? There's a real affordability crisis, as we've discussed previously. So it's about contextualizing care delivery within within the parameters of what someone can afford or not afford, candidly, right? And that's how you address things like adherence as well, which is key to obviously delivering superior clinical outcomes.
Yeah, no, you touch on something that I think that we talk a lot with our customers is the bill pay experience. It's not its own stop in the patient journey. It should be intertwined with everything from that initial scheduling of the appointment all the way through. And anytime you have a touch point with a patient, it really should account for with that financial experience as well, whether it's delivering an estimate, maybe trying to get a down payment, maybe setting somebody up for the payment plan if it's something that they can't afford from on its face because it's an unplanned thing. It's weaving that throughout the process. And if you would have looked at the industry 15 years ago and made that comment, I think everybody would be like, whoa, that's crazy. I can't ask my patients to pay. This is not what they're here for. And I just don't think that's the case anymore. Patients know that they're responsible for part of their care, and more so than ever before through the changes with the way insurance plans go and how health benefits are being distributed by their employers, that they know they have to pay. Let's just make it easier and more convenient for them. And I would say the other thing related towards from a provider standpoint is they don't do this, I think they're going to be left out from a competition standpoint as well. Because also, if you look back 15 years ago, the competition was this clinic down the road is competing for my patients, or this hospital down the road is competing for my patients. Now you have telehealth more prominent. You have direct-to-consumer medicine for certain things. You can get virtual care through your Amazon Prime membership. So the competitive landscape is just so different if you're a healthcare provider, that if you don't provide better service from a transparency, communication, and cost, you might just lose.
Absolutely. And I think this interesting, one of the survey responses, or what we found in that morning consult study that I was referencing, was that I think healthcare providers, right, and healthcare as an industry thinks it's done enough, right, with compliance as it relates to No Surprises Act, as well as, from a payer perspective, transparency and coverage. But this was interesting in that in the survey, what we found was when it comes to healthcare costs, right, patients are less likely than healthcare professionals to agree that the healthcare ecosystem or industry has systems designed to keep costs down, right? So this is front and center for patients, and there's almost like a mismatch of expectations in terms of how much has been done and the legwork that still needs to be done to bridge that gap between what patients are fundamentally experiencing and what and wanting versus what providers have delivered thus far.
Yeah, absolutely. And I mean, when you think about things, especially with the high deductible health plans and how much out of pocket people are paying, people are in a position now where they should shop around for an MRI, because maybe if it costs a quarter of the amount from the private group, even if it's not even covered by their insurance, it may not even matter, because they're not going to hit their deductible or their out-of-pocket max for the year. So that shopping around is absolutely happening, and stuff like the No Surprises Act and posting of the patient or of the billing amounts is just, it's a step in the right direction to allow them to do things that they just haven't been able to do before.
Absolutely. And that same study has eliminated concerns where 2 in 3 patients say they're concerned about their ability to cover costs in the event of an unexpected illness or medical condition, right? Similarly, it's 1 in 4 patients that postpone health or medical care due to the inability to afford the cost of a treatment. So we're not only seeing an uptick in price shopping, right? But we're also seeing, patients making really hard decisions, right? And deferring care, which obviously any provider would agree is not ideal, neither for the patient nor for obviously, the industry.
Yeah, I think that's a great segue into kind of the second topic that we wanted to cover today about patient choice is, you're going to have these patients that aren't able to pay for all the reasons that you just said. But does that mean that we should just give payment plans to every single patient that's out there and comes in our door?
Absolutely not, right? And I think you and I have had discussions about this previously as well, where I think there needs to be an intelligent risk stratification that needs to be done to try and identify different patient populations, right? So those that actually have a demonstrable need for payment financing, whereas there needs to be a delineation between those cohorts or populations of patients relative to those that can afford to pay 100% of the bill, and that should be billed on that, with the expectation that they're going to pay on time, right? So there needs to be that risk stratification, which is what I was touching upon earlier, where we're seeing a lot of AI-driven underwriting, right, and that risk stratification work being done on account of advanced propensity to pay analytics, if you will, that then allow you to deliver patient payment financing to the most vulnerable populations versus leaving them behind under the current system.
Yeah, I don't think we're seeing news headlines recently of hospital margins going through the roof in them. So you need to balance that cash flow and getting the patients to pay as soon as they're able to, while still giving that flexibility and empathy to the patients that are maybe not able to pay all up front when their balance is due. So when we think about flexibility, I mean, Mastercard comes to mind for me when it comes to different methods of payments. Obviously, like the digital wallet, but you've got other tools like that. I guess, what are you seeing in terms of more than just straight up payment plans to be able to pay off some of these balances, and what's available to patients or what providers can be doing?
Yeah, as I was mentioning earlier, I'll bring it back to, what we're seeing from a leading edge perspective, right? The ability to develop a financial health index for healthcare consumers, much like you have a clinical profile, you match that with a financial profile, right? There's plenty of data that's out there, right? It's streamlining that data to create a single source of truth, if you will. Mastercard itself brings anonymized spending data, right? Benefit related card activity and transaction data that can then be used to create, benchmarking dashboards, right? That we're bringing to payers and providers, right, to help them determine what affordability looks like, and what payment success and or churn risk could look like, right? And it's all being brought together by obviously now AI models that detect those financial distress signals, if you will. So that's what we're seeing happening within the industry by at least folks that are looking to proactively change that patient financial engagement and experience before, to your point, legislation kicks in. Alongside that, we're seeing things like contactless point of care solutions. So things like tap to pay to streamline the experience, right? Mobile wallet and bank apps. The ability to use a smartphone to scan for payment options, and then that's within the office setting, but there's also out of office solutions where you're leveraging things like SMS for payments, online payments, mobile payments. So, those are some of the things that we're seeing that are driving success and elevating the patient financial experience.
Yeah, I think my muscle memory is there, so that if I always just tap whenever I'm paying in person, and when it doesn't work, you have the person behind the desk goes, "Oh no, we don't actually take that. You gotta insert it." It's like, oh, okay. Well, so tap to pay, and then those new payment methods are definitely top of mind. But also one thing that we'd like to, I mean, the thing about healthcare is there is no healthcare demographic. Everybody's a patient. It doesn't matter if you're 20 or 40 or 60 or 90, you're gonna be seen by a healthcare provider. And when you think about that patient experience and patient journey, you can't just tailor it to the most common patient, because that there isn't one. There's all sorts of different groups that are out there. So you have to be able to support the individuals that are super tech savvy, that know how to use the latest and greatest payment methods. And you probably also need to think about the groups that are using just straight up the debit cards only, or even ACH in some cases, where they just, that's just how they pay. So you need to be able to not only, so you need to support the payment method of choice based off of their preference and where they are, and meet the patient where they're at. But also, just like what you said, I don't know where else you pay online or over the phone or in person, and in payment plans and at a kiosk and at the parking garage and the gift shop and the cafeteria within a hospital, and go down the line there. So it's a very complicated ecosystem when it comes to payments.
Indeed, indeed. And the other thing I'll mention is uh, choice and personalization can also be enabled by more straightforward things. So just communicating someone's benefits to them. I touched upon this a little bit earlier, but you can promote the discount or sale nature of using one's HSA or FSA. So often those cards are out of sight, out of mind, right? But being able to surface visibility of the balance that's sitting on an HSA or FSA card is a really powerful way of showing the patient what they have access to in terms of resources, and then alongside that, right, communicating that, look, you can save up to 30% on everyday healthcare items like copays, right, prescriptions, and effectively communicate that as a coupon, right, on your next visit to the provider, or when you go to CVS or Walgreens or whatever else, right? So the messaging could be there there could be, you're paying enough for healthcare, right? Don't pay taxes on it too. So it's the education that needs to be done proactively. And then, of course, there's ways to elevate the experience with technology, of course.
Yeah, and I think on its face, if you're a provider and you start, oh my gosh, I've got to cover all these different payment methods and all these different ways to pay, this seems like a lot. I think the where we are in the ecosystem as well is this is not the early days of it. I mean, this has been going on for a long time. So I think there are, if I plug us a little bit, I mean, we live right in the healthcare payment space. That's what we wake up and do every single day. I mean, we're not trying to work with groups in all sorts of different verticals. We wake up and want to focus on the healthcare provider side. So there are companies out there and groups that really understand healthcare and kind of cover all those different things. So it's not like you need to go and piecemeal a whole bunch of different pieces because it is so complicated. And even outside of the hospital, you think of the clinics and the ambulatory surgery centers and urgent cares and things like that. So just there are ways to do that it's not just this. It doesn't have to be a massive lift from a provider standpoint.
Yeah, absolutely. Sorry, go ahead.
I was just going to say, I mean, you've been in this space a long time as well. I mean, when you think about the groups that have advanced their way through the journey, I mean, what does that transition look like, or what have you seen?
Yeah, and of course, we've talked about what's aspirational, but it starts with just the fundamental building blocks. And someone like yourself is already doing all of that groundwork, laying the groundwork for ultimately achieving what the desired end goal or target state is. So this doesn't have to be something that brings a significant implementation burden, right? It's a iterative process, if you will. You're not going to solve for the most elevated experience from day one, right? But partnering with someone like yourself, right, who's laying the groundwork in the form of embedded payments, right, enabling that omni-channel support that enables one to meet the patient where they are in the channels that feel more familiar to them, whether that's text, right, web, right, mobile, integrating health benefit cards, right, things like tokenization, so that you don't have to pull the card out, right, and you can maintain someone's card on file, right? So card on file management is key, and then electronic communication of what options are available to patients, what things like their out-of-pocket costs look like as early along the various touch points. So it's truly not a surprise at the end of the journey, and that's going to drive not only a much better patient experience, right, but also improve self-pay performance. So
yeah, the token management thing, I mean, that's something that we've seen a lot more attention to recently. When you first implement an EHR or electronic payments, it's probably not top of mind, right? Because you're thinking that card that's going to get saved today, I'm going to use it next month or 6 months from now, and I can set up a payment plan and it'll all be good. But you got to think more than that. So what does that look like 3 years from now, 5 years from now, 10 years from now? Are you actively working with those tokens? Because those cards aren't good forever. They get reissued. They get lost or stolen, or they get expired, or somebody changes banks and they get a new card. So what are you doing to manage that? I mean, I know for me personally, when I log into my cell phone portal to pay, I have 5 or 6 cards saved in there. All of them don't work except for one, because all of the burden of managing that has been pushed on to me. And I think our customers that have done a really good job with it are really proactive with it by using tools to automatically clean up those tokens and make sure that they're automatically updated when a card gets reissued for whatever reason, especially with how prevalent payment plans are now and being able to put patients on those. You don't want that to stop after 2 or 3 months and then have to go call up the patient and say, hey, it looks like your card expired. Can we get a new one? That just adds more friction. Maybe they don't answer. Maybe you never get that, and you're not going to collect everything that's out there. And it's, again, becoming more and more prevalent. I think we looked at our system, and it's close to 60% of every transaction that originates on our system originates from a token. So it is becoming more and more prevalent in healthcare, especially with things like getting the card on file up front on a check-in or putting payment plans in place.
Yeah, and to your point, right, the less you have to do that introduces an incremental step to capturing that payment, the better it is for the patient and obviously for self-pay performance as well. So I think you're spot on with that.
Absolutely. Any other, as we think about the kind of the varying of the different kind of patients and types out there, anything else that comes to mind when it comes to providing some uniqueness, right tool to the right patient, or even for the right provider, that's not a one size fits all?
I think I think it's going to hit upon many of the same themes that we've been talking all along, right? Like individualizing the engagement to solve for the individual patient experience versus a one size fits all approach, right? And I think just building some of the basic capabilities or the fundamental capabilities that allow you to enable that personalized journey or deliver a personalized experience for the patients is where you start off, right? And often that can seem like a challenging task, but with partners such as yourselves, right? I think a provider can easily realize those building blocks that are required, and then in an iterative process, you layer in some of the leading edge capabilities that we've talked about.
Right on. Well, I'm looking at the clock here, and I think we're coming up on our time. So I really enjoyed this conversation with you. It's been a pleasure. Why don't we turn it back over to Melody for next steps for our session here?
Likewise, thank you.
All right. Thank you, Mohit and Ryne, for sharing those valuable insights. We now have a final poll up to get your thoughts after listening to our great speakers, and we really appreciate your participation. So let's get started. Let's move into the Q&A portion. We have a few great questions, so let's get started. The first question is around AI. How important do you think adopting AI throughout the healthcare payment experience will be over the next 12 months?
Yeah, I mean, I think
Ryan?
yeah, with
Go ahead.
anything, I mean, AI is everywhere, right? AI is going to be incorporated into everything. So I don't know if I necessarily think that it's going to flip everything on its head, but I do think it's going to make a lot of things more efficient. So how are we applying it? I think we touched on a couple of them, and Mohit, you did as well, with things like the being able to pull maybe benefits better in real time, or maybe offering different payment plans and things like that. But I think in general, it's going to help make that user experience a little bit more personal. What do you think, Mohit?
Yeah, no, that's entirely accurate. And I think the short answer is vary, but I think providers need to be realistic about it and make strategic investments that tangibly deliver value candidly. So it's those things that we've been talking a lot about. So AI-driven coverage and benefits verification, more accurate out-of-pocket services estimates, automated reminders and chatbots to help patients manage payments, answer billing questions, especially supporting those that are navigating very complex pathways, and then those investments in AI-based tools to help with custom financing options. So that's just a quick take.
Nice. Next question. How do we give patients as much flexibility as possible in their payment options while still reducing the use of cash or paper checks?
Yeah, so I think that no one, so obviously patients elect to pay by check primarily out of habit, or things like the perceived risk posing from alternate payment choices. But that's where I think providers need to do more work to educate patients on the merits of paying via other payment modalities such as card. And part of cultivating that trust is making sure that there are solutions in place such as card on file and or click to pay secure digital checkout. If it's ACH, I think the concern often from patients is, I'm going to be entering my bank credentials, and how do I trust that that's safeguarded? So providers can implement open finance solutions that streamline that experience by enabling bank account connectivity via API-driven solutions versus requiring things like manual and error-prone entry. And as much as that you can do as a provider, I think you'll find that with the elimination of friction associated with those other payment modalities, patients will self-elect to convert from check to these electronic methods of payment. Ryan, what's your take?
Yeah, I agree. I mean, I think at the end of the day, it's not about outlawing or banning certain types of payment methods. It's really just making the alternative ones easier. And I think you had a couple of really good examples on there. And compliance and security, I think, is a big part of just building that trust and making sure that that patient, when they provide that information to you, that they know it's going to be kept secure. Seen some, I mean, there's some things that are becoming more common now, but I mean, we've all gotten that paper statement in the mail that has the envelope in there that says, hey, well, you can put a check in here and mail it back. Maybe don't send that first. Maybe send the electronic notifications first and see if they pay there. And if they don't respond to an email or a text or a message from your patient portal to go in and pay, use those, encourage those other ones more later on as more of that last resort, not as an upfront, hey, shoot, this is an option for you. Do you want to take this one?
Absolutely.
Nice. And then the next question is around security. How can we trust that these different payment methods can still be safeguarded?
Yeah, I think when I think of security, and especially in the healthcare space, it's always top of mind for everything, regardless of whether it's payment data or healthcare data or anything like that. So I think the culture is already there for most healthcare providers to have this be top of mind when they're making a decision. I know when we're talking with one of our customers or one of our prospects, we get asked about it all the time, and we know we've got to be proactive to say, this is what we're doing about it. This is how our tokenization system works. This is how validated point-to-point encrypted systems work. But as we start seeing different payment methods that don't fit nicely into those buckets, having those conversations and asking them, all right, how is this safe? What are you doing to be compliant? Can I understand more about the processes and steps you have in place? Are just good questions to ask.
Yeah, and I agree, right? It's about ensuring that they're adhering to the highest standards and have implemented stringent controls. So things like, and we touched upon this earlier, tokenization, as you mentioned, validated point-to-point encryption, implementing leading ID verification solutions to keep fraudsters from entering their digital ecosystems, third-party risk management to ensure protection against vulnerabilities that their supply chains and vendor relationships may expose them to. And then it's things like working with, from again, third-party relationship standpoint, with vendors such as yourselves, or partners such as yourselves rather, that have things like high trust certification, especially as providers move away from legacy infrastructure and modernize the tech stack that power those patient-centric experiences.
All right, I think we've got time for a couple more that have come in. How do you see patient payment needs evolving over the next 3 to 5 years?
So I think that affordability is going to be front and center, especially as you see the shift of financial responsibility onto patients. And that's reflected in things like high deductible health plans, co-pays are increasing, there's the use of co-insurance. So, those all represent opportunities for providers in turn to pay more attention to the patient payment experience. Um, they need to be focused on being able to collect patient balances earlier in that care journey. We've talked about the investments that need to be made in AI-based tools. So how do you help patients navigate payment, financing options? I think there's going to be a need for better integration into EMRs, practice management systems, right, on account of the various players within the ecosystem so that they can improve the patient experience. I think embedded financing will also take center stage in many ways. So it's things like, integrating financial services, whether that's payments, lending, or insurance directly into healthcare software. So I think those are just a couple of themes that will emerge in terms of how the patient needs will evolve, so to speak.
Yeah, and I agree completely on the affordability and the kind of more of that burden being shifted to the patient when it comes to their own responsibility for their out of pocket for the care. And some of the things that we've seen in other industries, I mean, more recently, is more of that kind of buy now, pay later payment plans, that flexibility for it. Now, I think there's a lot of great use cases for it. If you're buying a new big appliance or something like that, great. So I think especially for these high dollar amounts, especially given that a lot of times healthcare is just, like we talked about before, an unplanned event that you're not really budgeting for, being mindful of the ability to pay is just going to continue to be front and center, and that doesn't seem like that's going away anytime soon.
Great. In your experience, what's the most impactful change an organization can make to improve payment transparency without overhauling the entire system?
Yeah, I mean, the first thing that comes to mind for me is just giving the patient as much information proactively before care is given whenever possible. Now, you can't do that for an emergency room visit or things like that, but providing that context, you're already having some touch points there already. Somebody is engaging with them for the purposes of scheduling the visit, for the check-in, for gathering insurance information. There's a lot of opportunities in that pre-visit path to be able to say, oh, hey, Ryan, by the way, this is going to cost this amount. How do you want to take care of that? Should we get a card on file? This is a really big number. Should we get you on a payment plan already? Do you want to talk to a financial counselor that's within our organization or something along those lines to be able to talk through that? So I think just moving more and more of the financial conversation to the front of that patient journey as possible feels like a big win, and it'll help with both the collections and just patient happiness, reducing the amount of surprises that might happen later.
Yeah, and I'd agree with everything that you said there, and I think the central theme there is just proactive communication, leveraging that omni-channel framework, such that you're ensuring it's a consistent experience regardless of the channel that the patient is residing within.
Thank you. And one more, how do you recommend healthcare leaders prioritize payment innovation when budgets and resources are tight?
So I think the rationalization there is relatively straightforward in that if you're not going to prioritize payment innovation, you're going to have rev cycle leakage, and so I think it impacts the bottom line. So how are you going to improve self-pay performance if you're not prioritizing payment innovation? So I think that's the rationalization, and as as providers think about the patient experience, they can look to track key metrics, and all of those impact the bottom line. So it's like if you're making investments in your patient portals, so it's looking at things like what the adoption rates are, how are you better engaging patients, so what are your communication engagement rates, right? How successfully or at what rates are patients opening things like e-bills, right? And how is that translating to things like driving payment behavior, such as the percentage of bills paid, or how long are patients taking to pay those bills. So I think they can all be rationalized by things like closing the rev cycle leakage that providers are faced with. Ryan, what's your take?
Yeah, I agree with all that. I think the other thing too is, I mean, anytime you look at getting paid, the ROI should be there, and it should be fairly easy to calculate. I mean, maybe easy is the wrong word, but like the information's there. And again, like we talked about before, healthcare is not an industry where you're collecting 100% of your receivables from all of your customers or your patients, right? You're not collecting it already. So there's going to be room for improvement, and any ROI should be able to be calculated by saying, all right, if I implement this, which of those metrics that you just mentioned is this going to drive? Am I going to reduce the amount of bad debt? Am I going to reduce my AR days? How can I implement those things? But it goes beyond just the direct ROI stuff. There's a lot of indirect benefit too. By providing a better experience for the patient, their last experience with you might not be, oh my gosh, I got surprised with the bill. I didn't know how much it was. I'm never going there again. Or I just got my Press Ganey survey for HCAPS, and I'm filling this out, and the thing in the top of my mind is the billing experience, and not how great the nurse was or how talented and passionate my doctor was. I'm just thinking about my poor billing experience, and I'm going to give bad scores there, which ultimately is going to be the negative outcome as well for you as an organization. So I think there's a lot of benefit by going at it and just empowering the teams to look at it and say, all right, if we implement this, what are we going to get out of it? And doing that math, it should be there.
Absolutely. And I think the central premise there really needs to be, how do patients receive and understand cost information before care is delivered? Because that's going to help elevate the patient experience and also drive some of that performance that we're talking about.
Perfect. And I think we'll end on this question, and you touched on a little bit in your last response, but maybe just a quick summary. What metrics or signals should organizations track to know if their payment experience is actually improving that patient engagement?
Yeah, I think you touched on this just a little bit ago. I mean, if anytime you implement something that impacts payments, you should look at the benchmark beforehand. What are your AR days? How much is being collected? How much of your bills are being collected within 14 days, 30 days, 60 days? How much is being sent to collections? Just looking at all of those different pieces from a before and after standpoint, setting goals, tracking towards them will kind of help validate and some of that ROI stuff that I had. Anything I missed there, Mohit?
No, I was just mentioned maybe call abandonment rates, first call resolution if you're tracking call center metrics, but I think you captured this fairly well.
All right, that brings us to the end of today's session. A big thank you to our presenters, Mohit and Ryne, for sharing their expertise, and to all of you for joining us and taking part in this discussion. A recording of the webinar will be shared with you soon, along with additional resources. And on behalf of TrustCommerce and Mastercard, have a wonderful day.